assessing the musculoskeletal system. So, for the good day, sir. I am your nurse Miguel. I will be your nurse for today. Can I ask you to state your name, birthday, and your age?
My name is Miguel Marlo L. Espinosa. My birthday is March 14, 2006, and I'm 19 years old.
So, sir, for today, we are going to assess your musculoskeletal system to assess for the gross abnormalities. So, sir, I would like to ask for your permission since I will be touching your upper and lower extremities, if that's okay for you, sir.
Yes.
So, sir, I will now provide privacy by closing the doors and the windows for a private room, and for if there is a public room, I will close the curtains for privacy, and also if necessary, I will also put drapes for privacy. I will now position the client. So since the client is now positioned in a sitting position, I will now proceed to the assessment. So for today, sir, I will ask you some questions. So, sir, do you have any history present? Do you have any history or presence of muscle pain?
No.
Do you have any associated signs and symptoms for muscle pain?
No.
Do you have limitations to movement?
No.
Do you feel a loss of function or movement?
No.
Do you have any previous or current problems involving the musculoskeletal system?
None.
So, sir, I would like to ask you to stand up. Since I will be observing your ability to perform functions of daily life. So, sir, can you do personal hygiene? Can you toothbrush yourself, bathe yourself?
Yes.
Okay, sir. Can you sit down and then stand up? Can you do walking up and down the stairs?
Yes.
Okay, sir. Do you walk on a level surface? On a straight surface, okay, sir. While you are doing these activities, do you feel any pain while doing these activities?
No.
Okay, sir. Then you can now sit down. Then I will now examine the arms and legs. I will note the size and the symmetry. And I will also assess for muscle mass, if there is muscle masses. So it is symmetrical. There is no muscle mass and abnormalities in the upper and lower extremities. And now I will assess the spine. Sir, can you stand up? Can you do the flexion like this? And then can you extend like this? And then after that, sir, I will ask you to rotate your spine, like can you rotate your like this, sir, and can you bend it sideways? So there are no abnormalities in the spine. And now I will move to the joints. I will assess major joints, noting for any limitations to active range of motion, swelling, or tenderness. So there is no abnormalities for that. And then I will now assess the neck. Can you flex your neck, sir? Then extend your neck. Then can you rotate it? So there are also no abnormalities. Can you feel any pain while doing that, sir?
No.
Please, sir. And then I will now proceed to the shoulders. Can you flex your shoulders, sir? Flex it. Then extend it. Then after that, sir, I would like you to rotate it. Can you feel any pain while doing that? So there is also no abnormalities for the shoulders. And then I will ask you, sir, to flex your elbows like this, sir. Then extend your elbows. Then do the supination like this, then the pronation. So do you feel any pain while doing that? Okay. So the elbows are also doesn't have any abnormalities. And now I will proceed to the wrist. So can you flex your wrist, sir? Flex, then extend. Then can you do like this and like this for the dorsal and for the ulnar and radial pronation. Then after that, sir, I will ask you to also flex your fingers. Flex your fingers, then extend it. Then abduct it. Then adduct it. Do you feel any pain, sir? So there is also no abnormalities or pain when doing the tests. So after that, sir, I will now ask you to flex your hips. Flex your hips, sir. Extend your hips. Then do the twist it. So do you feel any pain, sir?
No.
Okay, there is also no pain. There is also no abnormalities for the hips. And now, sir, I will need you to flex your knees. Then extend your knees. The other one, sir. So do you feel any pain, sir? No. Okay. So there are also no abnormalities for the knees. And now I will do the assessment for the ankles. So can you sir do dorsiflexion like this, and then plantar flexion, then inversion, then eversion. Do you feel any pain?
No.
Can you do it in the other dorsiflexion? The dorsiflexion, the plantar flexion, the inversion, and the exversion. Do you feel any pain in the other legs here? So there is no abnormalities also and pain for the ankles. Now I will now ask you to, can you flex your toes, sir? Like this, then extend your toes, then abduct it, then adduct it. Also the other one, sir. And do it like this. Then, do you feel any pain, sir?
None.
Okay, sir. Since there are no abnormalities for that, I will now palpate for the joint of the neck. So I will palpate for the joint of the neck. So to feel if there is any masses or is it symmetrical. So it's symmetrical and there is no masses and abnormalities. And then after that, I will now percuss. I will now palpate to assess the size, tone, and any tenderness in the muscles. So there is no any abnormal mass. There is no masses in the muscles as I can palpate. There is no abnormalities. And then after that, I will now do the percussion in the spine. Sir, can you face the wall? So I will now percuss it, starting from the cervical into the lumbar. So there is no abnormalities, there are no swellings. As I saw in the percussion, I haven't heard any abnormal sounds. And then I will now ask the patient to, sir, can you sit down now? Then I will now, I will now position the patient comfortably. And then I will inform the client the findings. So sir, while assessing you for the musculoskeletal system, I haven't seen any abnormalities. in your musculoskeletal system. But if there is any abnormalities, I will advise you to go straight to the physician to ask for any if there is any other problems. So after that, I will now wash my hands and then throw the I will now wash my hands. After washing my hands, I will now document the findings and report any significant deviations from normal to the physician. So sir, thank you for actively participating for today. Thank you. Thank you, sir. So for today, I am going to do the assessment for the neurological system. So first, I will be preparing my equipment such as the reflex hammer, the pen light, and the tongue depressor, and also these alcohol balls. Now, sir, now I will now be reading my patient and I will identify my patient. So, sir, I am your nurse for today. I am Nurse Miguel. Can you state your name, birthday, and your age?
I'm Michael Marlo Espinosa. My birthday is March 14, 2006, and I'm 19 years old.
So, sir, for today, I am going to assess your neurological system to test if there to see if there is any gross abnormality in your referring to your neurologic system. So now I will be providing privacy by closing the windows, the doors, or curtains if there is any, and I will provide PJ if it is necessary. Now, now I will be proceeding to the assessment. So now, I will now position the client. Sir, can you sit? Can you have a position here? In a comfortable position. Okay. Now I will now be noting the components of the neurological examination, such as the mental status, cranial nerve function, cerebellar function, motor function, sensory function, and lastly the reflexes. So first, I will be assessing the mental status. So sir, do you have any history of medical illness, in mental illness, mental conditions, any family history of mental illnesses? Any previous any previous procedures that involved in your mental health?
None.
Answer, okay. After that, I will now proceed for the sir, I will ask you what date is today and where are you right now and what day is it?
It is July 26. I'm in my home. It is Saturday.
Okay, sir. Do you remember what are we doing right now?
Assessment.
Can you state what did you do yesterday?
I play basketball.
Can you remember any memories that you did last year? Big events like that?
Yes. My basketball event.
Okay. So now, sir, I'm going to ask, do you know some current events right now? What's happening in the Philippines right now?
Typhoon.
Okay. Who is the president right now?
President Bongbong Marcos.
Okay, sir. Thank you. Now I will be questioning you for problem solvings, like can you do like mathematic expression like 6 times 6? Can you answer like that?
Yes.
What 6 times 6?
36.
Okay, sir. Now I will be. Do you feel any recent changes in your mood? Nothing? Okay,
Yeah.
sir. Now I will be assessing the cranial nerve for the functions of the olfactory nerve. So, sir, can you close your eyes? And now I will be testing the patient. Sir, can you smell what is in this? What can you smell?
Alcohol.
So he can smell the alcohol. So his olfactory nerve is working. So after that, I will now do the optic nerve. I will test for the visual acuity. Sir, can you look at the Snellen chart right there? Can you read it?
Yes.
Okay, sir. And I will also check for your light reflex. So there is no abnormality in the optic nerve. So now I will be proceeding to the oculomotors number 3, 5, and 6. Number 3, 4, and 6. For the extra oculomotor, I will now evaluate the 6 cardinal movements of gaze. So sir, can you follow this only with your eyes? So there is no abnormality in there. So now I will now perform the cover and the uncover test. Sir, can you cover your right eye and look at this? Then look at far away. Look at focus at this. Okay, then remove the cover. Then cover your other eye. Then remove it. So there is no nystagmus. Okay. And now we will now proceed to the reflection to light of the pupils. So the pupils are constricted, so it is normal. Now I will proceed to the facial nerve. I will now assess the symmetry of facial movements. Sir, can you smile? Can you frown? Can you also do grimaces? Like parang ano po kayo, may masakit, ganun. Sir, can you also clench your teeth? Like do this back and forth. So now I will be doing the acoustic nerve. For the vestibular branch, I will perform the Romberg's test. I will check if there is movements of swaying, and I will test this for 20 to 30 seconds. Sir, can you stand up and then close your eyes to test your balance? Position, okay. Okay, so there is normal balance. There is no excessive swaying. You can now sit down, sir. And now I will check for the glossopharyngeal nerve. I will ask the client to move tongue from side to side. And do it like this, side to side. Okay. And I will test the gag reflex by gently touching the I will now check the glossopharyngeal nerve by by testing the gag reflex. Now I will use the tongue depressor. Sir, this might hurt a little bit, so can you open your mouth? Can you open it widely? So there is a gag reflex, so there is normal. So there is normal in the glossopharyngeal nerve. So now I will move to the vagus nerve. I will ask the client, sir, can you swallow? Okay, there is normal swallowing, and the vocal cord movements are normal. Now I will assess for the accessory nerve. I will assess the strength of the sternocleidomastoid and upper trapezius muscle by asking the client to move the head against resistance. So, sir, can you move your head? Okay, sir. Okay. So there is normal. So the resistance is strong. So now let's move to the hypoglossal nerve. I will now test the strength of the articulation tongue by having the client to push the tongue to the side of the mouth against resistance applied to the cheek. Can you do it here? In the cheek. Okay, so there is normal hypoglossal nerve. There's no abnormalities in that. It is symmetrical. Okay. Now we move to the cerebellar function. I will now assess posture, gait, and balance. Sir, can you walk now? Walk forward. Then walk back straight. Okay, sir. Now, I will now assess the coordination in the upper extremities by having the client to perform the finger to nose test. So, sir, can you touch my finger to finger, then put it in your nose? No, your finger, sir. Put it in your nose. Okay. So there is normal cerebellar function. Now, I will be assessing the coordination in the lower extremities by having the client tap the toes and slide the heel down the contralateral skin. Sir, can you position yourself in a supine position? So, sir, can you put your heel here? Put your toes here, sir. Like this. Then move it. Slightly, yeah. Then move it. So there is normal coordinations in the lower extremities. Now I will move to the motor function, muscle mass. I will assess for the symmetry and distribution distally and proximally and circumference of extremities. So, sir, can you stand up? So now we are going to assess the motor function. For the muscle mass, I will now assess the symmetry and distribution and distally and proximally and circumference of extremities. So, sir, can you stand up so I can check for the symmetry of the proximal and the distal? So, the extremities are symmetrical, so there is no abnormality. Now I will evaluate the resistance of muscles in response to passive motion during flexion and extension of extremities. So, sir, can you flex your knees, yes, then extend, and also this the other side. So there is resistance of muscles in response to passive motion during flexion. So for this strength, I will now assess the hands and squeeze muscle strength in each extremity against resistance during flexion and extension, abduction, and adduction, comparing bilaterally weight on a So, sir, I will need you to squeeze my hand. Muscles, okay. And then the other one. And, okay, sir, can you flex your arms? Then extend it. Then abduct it. Then adduct. So, I will rate it 5 as since it is normal. Then I will now observe for involuntary movements such as tremors, tics, twitching, fasciculation, and abnormal postures. So there is no tics, there is no abnormal involuntary movements as we can see in the patient. And now I will now check the sensory function. I will ask the patient to close. Sir, can you close your eyes? Then I will. What can you feel, sir? Is it soft?
Yes.
It's soft, sir. And then I will now repeat the pattern of light touching assessment using a sterile safety pin to elicit sharp sensations. Since I have no pin, I will just break my cotton tip applicator to assess if it's sharp or dull. So, sir, what can you feel? Is it dull or sharp?
It's the
Here, sir, what can you feel?
picture.
What can you feel, sir?
It's done.
What can you feel
Which
here? What can you feel here, sir?
dull,
What can you feel now?
sharp, dull, sharp.
Okay, sir. Thank you for that. And now we will proceed to the diagnosis. I will now ask the client to identify number that is tracing his palm with your fingertip. So, sir, can you small object? I will now assess the patient. Sir, can you see what's in my hand?
Yes,
What can you see?
it's a tape,
And now, sir, what can you see?
cotton buds,
Okay, sir. And now, sir, what can you see?
uh, like,
Okay, sir, thank you for that. So there is no abnormalities in the diagnosis. Now I will do the graphesthesia. I will ask the client to identify a number that is traced in his palm with your fingertip. So, sir, can you see what number is this?
1, 2, 5, 3, 2, 1, 4, 3, 5, 1.
Okay, sir, thank you. And now I will assess for the deep tendon reflex in striker with a reflex hammer. So, sir, can you sit down? Can you position yourself in a sitting position? I will now strike my hammer to see if the reflex is if there is reflex. Can you feel it, sir?
Yes.
So there is reflex. So there is reflex in the deep tendon reflex. So I will be grading this into a hyperactive, since it when I strike it flex. So now I will go to the brachioradials for the C5. Now I will strike the radius tendon about 1 to 2 inches above the wrist and observe for flexion and supination of the forearm. So now, sir, I'm gonna the other one, sir. Okay, so I'm gonna grade that. So for the biceps, we will now go to the biceps. I will now place my thumb or forefinger at the base of the biceps tendon and strike it and observe for flexion of the arm below. So bicep. So here. And the other one. And then I will now move forward to the triceps. So the triceps, I will now strike the triceps tendon just above the elbow. Also the other one. Ayan. So the other hand of flex in the triceps, extended, not flex, extended pala. And now for the patellar quadriceps, I will sharply strike the patellar tendon. Observe the extension of the knee. So there is extension in the knee. Now I will do the Achilles ankle jerk. I will now support the client's foot in the dorsiflex position and tap the Achilles tendon and observe for plantar flexion. So there is flexion, extension, as observed. And now let's proceed to the superficial cutaneous reflexes, known as the abdominal stroke, above the T8, T9, T10, and the T11 and the 12, the umbilicus bilaterally. So, sir, can you position yourself in a supine position? Can higa po kayo? So now I will just do this and see if there is any contractions. So there are contractions in the abdomen, and now I will now proceed to the cremasteric reflex. So for the cremasteric reflex in a male client, stroke the inner surface of the thigh, observe for prompt elevation. So sir, I will just ask, can you feel something, sir?
Yes.
Can you feel your testes like moving racing?
Yes.
Okay, sir. So there is normal cremasteric reflex. And now for the plantar Babinski, I will now extend the client's leg with the feet relaxed, then stroke the lateral aspect of the sole from the heel to the ball of the foot, curving medially.
Ang hirap.
And now for the plantar or Babinski reflex, I will support my client's foot, and then I will do the Babinski reflex right now. So for the Babinski reflex, I will be stroking the lateral aspect of the sole from the heel to the ball of the foot. So by this, you can see that it's moving. That is the Babinski reflex. So that is the Babinski reflex, and let's do it in the other one. Okay, so there is normal Babinski reflex as seen in the patient. Now, let's move to the pathologic reflexes. So now we will perform the Brudzinski sign. I will now flex the patient's neck forward while in a recumbent position. Then observe for voluntary flexion of the knee and pain. So sir, can you feel pain in the legs? No. Can you feel movements? No. Can you feel it, sir? No. Okay. Then after that, I will now do the kerning side. I will flex the patient's leg, hip, and knee, and observe for flexion and pain. So, sir, I'm gonna do this. Can you feel any pain? No. Flexible. Okay, sir. And now I will now do the clonus sign. So there is normal clonus, there is no abnormal clonus. And then after that, I will now position the client comfortably. So you can now and now position my client comfortably. And then after that, I will now inform the patient about the findings. So, sir, there are no abnormal findings in the neurological system for that assessment. So, thank you for actively participating in the assessment. We have not found any gross abnormality. And now I will wash my hands. I will now wash my hands And then after washing my hands, I will now document. I will now document the procedures, document the findings, and I will report significant deviation from normal to the physician. So that is all. Thank you for watching. So thank you, sir, for actively participating.